So, sir, can you just tell us what exactly is the cause of trigeminal neuralgia in a neurovascular conflict case?
Okay, so this is a very important question because not only a lot of research over the years has gone into it, but because this question I get asked multiple times. Every patient who comes to me, he asks me, but why does this pain occur or why does neuralgia occur? Even the practitioners, the doctors, I mean, they also ask this question. I get asked this question multiple times in different conferences because there are a lot of misconceptions around it. You will be surprised that these misconceptions are amongst doctors too. You know, sometimes I get asked, but doctor, our MRI does not show neurovascular conflict. So how MVD surgery can help us? Or sometimes people come to me with MRI done for some different things. And their MRI is showing neurovascular conflict, but they don't have neuralgia. So they ask me, doctor, our MRI is showing neurovascular conflict. So do we need surgery? You know, so these kind of questions are asked because the knowledge about this is not proper. So I am going to be very specific today and answer this question. Neurovascular conflict means what? I am going to take an example of a bunch of wires. Okay, let us assume that this is a trigeminal nerve, and trigeminal nerve contains these individual nerve fibers. Okay, each nerve fiber, like in a cable, each wire has got insulation of rubber. So each nerve fiber has got insulation of rubber, right? Why is this insulation required in a cable, electric cable?
To avoid the short circuit.
Correct. So that current flowing from one wire should not get short circuited to another wire.
Another wire. True.
In the nerve, it is required because one sensation should not get short circuited to the fibers of other sensations. Right? For example, I'm touching, I should feel the touch, not pain.
Yes.
Or if I'm pinching, I should feel the pinch and not soft caress. So these nerves are different and they are insulated, right?
Yes.
Now, in neurovascular conflict, what happens is that, assume that this red wire is a blood vessel. Okay? It's a normal blood vessel. Everyone has blood vessels around trigeminal nerve. But everyone does not have a blood vessel which is actually pressing on the part of the nerve that is called as root entry zone. Some people do have this kind of anatomy. Okay, and as the age advances, the blood vessels elongate or become longer, and initially it is just touching, then it is compressing, then it starts distorting the nerve completely. So it is a progressive disorder. Okay, now only the presence of blood vessel, only blood vessel compressing on the nerve is not enough. Is not enough to cause neuralgia.
Neuralgia. Oh,
Some other things also have to be there. What is that other thing? It is genetic sensitivity of that nerve in root entry zone area, in that area. That means the production of the nerve, while it is being produced, that part of the nerve is defective.
Okay.
Or hypersensitive in these patients. Okay, so two factors are required. That in a particular patient, that part of the nerve has to be sensitive, defective, hypersensitive, anything you can say. On the top of that, there has to be a blood vessel compressing on that area. So when these two things happen together, then only neuralgia occurs. Understood?
So it is A plus B.
A plus B. So a person who has got a blood vessel pressing on the nerve, root entry zone, but that nerve is not hypersensitive, then that person will not get neuralgia. That is the answer of the first question that people ask me, that our MRI is showing neurovascular pressure, but we don't have neuralgia, what should we do? So you should not do anything because you don't have neuralgia, because your nerve is not hypersensitive in that area. On the other hand, the size of the blood vessel that is required to cause neuralgia or pressure can be very small. I will show you one photograph from our series, two photographs. One is a small arteriole, as you can see here. You can see very small vessel.
Yes.
Compressing the nerve critically, in a critical area. And in this case, this patient had hypersensitive nerve. So he had very severe neuralgia. Okay. And Another example is that of a small vein that is, hooking the nerve. This patient also had very severe neuralgia. So these vessels are not seen clearly on MRI. So it follows that MRI may not show a demonstrable blood vessel, but still the person can have compression and neuralgia. So the confusion is clear.
So is there any specific way to diagnose these things? So is it based on a clinical diagnosis?
Clinical. So diagnosis of trigeminal neuralgia is clinical, and the decision for surgery depends on perfect diagnosis one and ruling out of the medical causes of trigeminal neuralgia. Very clear-cut negative history or absence of history of multiple sclerosis like symptoms, or absence of history of previous herpetic attacks. That means other medical conditions which can cause neuralgia, they are very rare. I mean, out of 100, only 1% to 1.5% of trigeminal neuralgia patients will have medical cause of neuralgia. Okay. Also, sometimes tumors cause trigeminal neuralgia. These are relatively rarer cases.
Okay.
Even in tumors, mind you, the tumors push a blood vessel into the root entry zone of the nerve. So in the end, it is the vessel most of the times. But if we exclude these cases, then neurovascular conflict, the blood vessel causing this problem, is the cause of trigeminal neuralgia. And the nerve should be explored under microscope and endoscope in 360 degrees, and all the possible conflicts have to be removed in a symptomatic case. So I tell people that just imagine, I'll give you an example. Suppose there are clouds in the sky. Does it mean that it's going to rain? No. Perhaps it could rain, right? But if the clouds come in contact with cold weather, then the water vapor in the clouds gets transformed into water droplets and rain starts.
Yes.
So only clouds may not cause rain, but clouds plus cold weather will certainly cause rain. Similarly, only blood vessel, presence of blood vessel on trigeminal nerve will not cause trigeminal neuralgia unless that nerve is sensitive in the transition zone. You understand?
Yes.
So both the factors have to be there. And the caliber of the blood vessel need not be large enough to be seen clearly on MRI. Okay. Now, what is this defective or hypersensitive transition zone? I will again show you with the help of wires here. It is perhaps easier to understand with these wires. So this is red wire, this is blue wire. This red wire has got insulation in the form of rubber coating. You can see this. Blue wire also has got coating. Now, the coating, insulation coating, also called as myelin, that is formed around nerve fibers. This myelin is formed from different cells called as oligodendrocytes inside the brain. As the nerve is leaving the brain and going out, that part and the further part is myelinated, or the myelin is produced by Schwann cells. So the pattern of myelination is different. So there is a transition from one pattern of myelination to other pattern of creation of insulation. It's not a continuous one cell that is causing this. So let us say that this is a portion of the nerve that is inside the brain, nerve fibers inside the brain, and this is as it is coming outside the brain and further nerve. Now, if this junction is normal, it will be something like this. It is a perfect transition. There is no weak area in between. Okay. So this is called as transition zone, also called as Obersteiner-Redlich zone. Forget the name, just understand the concept. Now this is a normal transition from one myelin to another myelin. So here there is no possibility of short circuiting between adjacent nerves because all the nerves are well myelinated or well insulated. Now just imagine a nerve wherein during development of the baby, the myelin inside the brain, of nerve fiber inside the brain and outside the brain, this transition is defective. It is not well formed. Can you see this? Yes. So some portion of the nerve fiber remains poorly myelinated or even slightly unmyelinated. Okay, this is a transition zone. This white area in between at this transition zone is poorly formed myelin, and the bare area of these copper wires, as you can see here, this is perhaps not myelinated or very, very flimsily myelinated portion. So if such nerve fibers are present in a particular individual and a blood vessel gets in contact with this and imparts its pulsations continuously on the nerve, it will cause further demyelination or removal of myelination further, and then short circuiting and pain. You understand now?
Yes.
So both these things have to occur together. Then only people will get trigeminal neuralgia. So if we remember this, many concepts suddenly get, clarified. So this question which is repeatedly asked, why trigeminal neuralgia occurs, the answer is this. In pictorial sense, I can show you, as you can see in this slide, these are the myelinated nerve fibers. And this example is that of a cable. You will see the copper wires inside the cable. Again, they are myelinated or insulated. But if this insulation is removed, these wires will start cross-talking or there will be spark. A spark means pain. So this is what happens in trigeminal neuralgia.
Yes.
And these are few examples of photographs taken during surgery, wherein you can see the neurovascular compression or conflict, the nerve getting severely compressed by an artery. You can see pulsations hitting it continuously, and each blood vessel has got pulsations. In brain, even veins have significant pulsations. The arteries pulsate at the rate of our heart rate. So continuously these nerves are hammered, and this causes damage to the nerve in susceptible individuals, not in all, in susceptible individuals, and then trigeminal neuralgia occurs. Okay, you understood this concept, I hope.
Thank you so much.
Thank you.